Welcome to Redesigning Health and Home. I'm Meg.
And I'm Carrie. We love creating beautiful, functional spaces and living healthy, vibrant lives. So join us as we chat about simple, practical ways to take care of your body, mind, and your home. Whether it's fitness tips, home decor ideas, recipe, or navigating those big life moments, we're here to share what works for us and what doesn't, with some encouragement along the way.
Let's redesign this life together, one step, one room, and one habit at a time.
Hello, and welcome back to Redesigning Health and Home. I'm Meg, and today Carrie and I are beyond delighted and honored to speak with Laura Walsh. Laura Walsh, RDN, LDN, is a culinary dietitian, nutritionist, and ACE-certified personal trainer. She founded Walsh Nutrition Group, Inc. in 1999 as a way to share her culinary and nutrition expertise. Laura educates and inspires individuals to use behavior modification to build healthy lifestyle habits that promote health and wellness. Each client experience is individualized and focuses on making progress, not perfection. She continues to inspire clients that repeated small changes make the biggest difference. Laura, welcome to Redesigning Health and Home.
Hi, Meg. How are you?
I'm great. I'm so excited you're here so you can share. The business you built is amazing. So we're excited to learn from you. First, Laura, can you share your journey into becoming a dietitian? What motivated you to pursue this career?
Sure. So I actually didn't start out in dietetics. I started out in a degree called Foods and Business. So it was half nutrition, half business. And I wasn't really sure what path I was taking. So I got a job. I worked in a test kitchen developing recipes, but the recipes were very unhealthy. So I had always been interested in nutrition. I grew up in a large family, so food was always around. But I wanted to learn more about nutritional composition of food. I wanted to learn more about healthy eating, and the job I was doing just didn't seem like it was aligned with the path I wanted to take. So then I went back to school and got another degree in nutrition and dietetics.
Well, that sounds amazing. And
Thanks.
the first job actually sounds pretty fun too.
It was fun. It was a great experience.
But that's what motivated you to kind of switch paths though as well.
Right. I think sometimes you have to figure out what you don't like to figure out what you do like.
And then how long did you do that until you thought, you know what, I think I can do this on my own and start my own group?
So after I got my degree in dietetics, I worked a couple jobs, probably a total of 4 years. I worked at the Academy of Nutrition and Dietetics for a couple years, helping dietitians get reimbursed for nutrition services. At that time, there were very few dietitians that were getting paid by insurance companies to provide the services. So it was a very important job, but I was looking for something else. I then worked at the USDA doing nutrient analysis, which aligned a bit more with my food background. And I would go out to the school districts and help them improve the quality of the food that they were serving kids. So that was about a total of 4 years. And then I decided that I wanted to have a bit of a more flexible schedule and kind of head in a different direction with nutrition. So I started my company in 1999. So it's been 26 years, I guess. Yeah.
That's so inspiring. And both of those jobs sound like those were big positions to hold.
They were great jobs. It just wasn't where I wanted to stay.
Well, now you've been doing that and your group has grown quite a bit. Can you share a little bit about how that developed?
Well, initially, the business practice was really me doing food consulting for large food companies, recipe development, nutrient analysis. I was working with food service companies, helping them with their relationship with the USDA based on my past job.
That is so inspiring, Laura. Now, your group has grown since you started it in 1999. How has that process been with hiring new people? Tell us a little bit about that.
When I started my business, it was obviously just me, and I was doing consulting for food companies. And then as time went on and I started doing more counseling, I really wasn't able to handle the load. So then I had connections with other dietitians who had different backgrounds. For example, they might be a certified diabetes educator, and that's a really good skill to have in a practice. So as business grew, more dietitians were added, and everybody has a unique background so that I'm able to place our clients with someone who's a really good fit for them.
That's amazing. So speaking of diabetes and specialized certifications, we are seeing a hot topic right now with the weight loss medications and weight management. Since you have consults with one-on-ones, has that idea come up with you for nutritionally guiding them?
Yes, we do see people on the GLP-1 drugs. So those are glucagon-like peptide-1 drugs. They're basically, they help people control their blood sugar and feel very satiated. So it helps out with weight management, weight loss. In our practice, we have people who are not on medications. Our approach is lifestyle modification. So we do a lot of record keeping. We look at patterns. We look at habits and look for little areas that we can make changes in to improve their health. And then you keep repeating that. If someone can do that on their own with the modifications, exercise, we also look at trying to manage stress, sleep, because it's more holistic than that. There are some people, though, that do not have success on their own, and people with insulin resistance have a harder time losing weight, and that's where these drugs may come in and help them out.
Beautiful. Well, if I was someone that didn't have a medical diagnosis and this is a path I wanted to look down with some of these medications, where would I start? Would I come directly to your group or would I start with a physician?
People start with their primary care physician, or they may be seeing a weight loss medical specialist. That's where they would start because dietitians can't prescribe medications. But if someone is on the medication, we know how to work with them on their lifestyle to help them on this weight loss journey. For example, people can go on the medications. It suppresses their appetite. They eat less. But if they haven't made any changes to their lifestyle or they're choosing poor quality food, they may lose the weight. But then the question is, how do they keep it off? So that's where lifestyle modification is really important in the support of a dietitian to help people look at what they're doing, try to improve the nutrient composition of that, help them set goals, help them with motivation so that if and when they go off the medication, they are more likely not to regain the weight. There is thought that some people may be on the medications lifelong. Some people may cycle on and off. I think it's a very individual situation that they would work with their healthcare provider to determine what's best for them.
And are the healthcare providers then referring their patients to get those nutritional modifications with you and your group?
Yes, we do have relationships with certain facilities, certain doctors that refer their clients to us so we can support them in a different way than the physician is supporting them. Some groups may have dietitians of their own on their staff, so obviously they would refer them within their group, but it just is based on the contacts that we've established. But yes, we do get referral streams from doctors.
Beautiful. So how about the reverse? If someone was to come to your group with maybe a medical condition of being diabetic and you start them on the path of your nutritional changes, then are you suggesting possibly exploring this weight loss medication route?
I think that would be dependent on the person's results. There may be some people that have insulin resistance and we're trying to make modifications and they're doing lots of work on it. They might be in an energy deficit. They're exercising, yet the weight is remaining stable. Based on their labs, I can see that they have elevated levels of insulin or their fasting glucose is up or their hemoglobin A1C is up. then I might say, if they haven't discussed this with their doctor, I would say go back to your doctor, let them know what we're working on. Obviously, they're the ones that ordered the labs for you, so they know what you're doing. But we're at a point that you are doing what we would think would result in some changes, and it's not necessarily. They're improving their health by eating better and exercising, but if their goal is weight loss and it's not happening, and they may have something underlying like insulin resistance, that's where they may go back to their doctor and have this discussion if being on a GLP-1 is a good path for them.
Wonderful, Laura. This is all really interesting. I mean, it's beautiful that you provide an environment for those little changes that can multiply over time, but also there's other options that people can use. Can you then tell us some of the most common medications that are used for diabetes management or weight control?
Sure. And again, I don't prescribe these. We just see clients that have been prescribed them and they're working with their physician or healthcare provider to manage that. So we're in a support position to help them with the dietary part of that. But there's different types of GLP-1 medications. You have the semaglutides, which you've probably heard of Ozempic, and that is usually for people who have diabetes. And then the other one is Wegovy, and that's for people for weight loss who do not have diabetes. Then there's tirzepatides, and you might be familiar with Mounjaro, which is for diabetes. And then there's another one called Zepbound, and that's for weight loss. There are some other branded ones like Saxenda, but the ones being used now are a bit more effective, so you don't see people on those as much.
Who would be considered a good candidate for these medications you just mentioned?
Well, adults that have a BMI of 30 or higher, or maybe they have a BMI of 27 and above, and they have a weight-related health condition, maybe something like hypertension, high cholesterol, and diabetes. The healthcare provider will always assess the person's whole health profile and then determine what, with that client, what the best course for them is.
Sure. So after a consultation with your physician, is it then mostly people with obesity or diabetes that would be prescribed these medications and maybe referred to you?
That's what we're seeing. A lot of people who have diabetes. As we know, uncontrolled diabetes has lots of complications. So the weight loss helps control diabetes. It helps improve blood sugar. And then because of that, it helps decrease some of their risk for chronic disease. And we all know that obesity, though, as well, without diabetes, is a risk factor for chronic disease. All of those areas, I think people could benefit from weight loss, weight management. And if the GLP-1 drugs are needed, then that might be an appropriate path for them as well.
Perfect. Now, what kind of weight loss do people generally expect if they are prescribed one of these medications?
So that is very individual. Usually people will lose the most weight in the first 6 to 12 months, and the body after that can kind of slow down and it adjusts to the weight loss. The amount of weight that people lose, it's really kind of dependent on where they're starting and what's an appropriate goal that they want to end up at. What we see a lot of times is people may shoot for 5 to 10 pounds below a goal weight because as they go off the drugs, we do see them gain a little bit of weight in that 5 to 10 pounds. So it gives them a cushion. The one thing that we work with them on are habits, and the habits become really important when people wean off the medications and they're working on weight maintenance. So you can imagine if someone was, let's say, making poor food choices, they get on a GLP-1, it suppresses appetite, they lose weight by being in a calorie restriction, they go off the GLP-1, appetite comes back, and they go back to what they knew. That path is very detrimental to them because they had this success with the weight loss and now they're on a path that's setting them up to gain the weight back. The other scenario is if someone went on the medication and they were eating poorly, they work on their habits and they're changing them as they are on this medication. So now they have the knowledge of the path to go on after they start weaning off the medications. Weight management for some, even if they do that, it may be difficult. And that's where we see some people may be on these drugs possibly lifelong, or they may be rotating on and off. And that's something they would work with their healthcare professional to determine what path they should be on.
Well, it sounds like if this is prescribed to a person that needs them and then they find you would be the magic piece of that. And because that's what you ultimately want, are those habits that you're saying, to not revert back to the old eating habits. So finding the Walsh Nutrition Group would be just the perfect match made in heaven.
Well, I think so. I think we would be a piece of this big puzzle, but dietitians can definitely help support people learn how to make better food choices. In our group, when we work with people, it's very personalized. We don't just give the same message to everyone. We look at what is going on in your situation, and let's try to come up with some strategies that will help you improve health with the goal of living a longer, better quality life.
So if someone was to reach out to the Walsh Nutrition Group, would you have the perfect dietitian that you would match that person one-on-one with?
Yes. So people can book online at Walsh Nutrition Group, and they have the option of picking a dietitian to work with. We have descriptions on the website on each dietitian, so people can kind of see which one seems like they're a good fit for them. I usually reach out to clients after they book online just to make sure what they were coming in for and to make sure they're placed with an appropriate person. We all have the same training, though. We just may have areas, for example, like the diabetes educators. They're better working with people who have type 1, type 2 diabetes with maybe they're using continuous glucose monitoring. They can better interpret the results of that than probably myself. I can easily work with people with type 2 diabetes, but the more complex the case comes, that's where you would go to someone who's more of a specialist in that area.
Beautiful. Now, if someone is on the medications and they are considering maybe slowing down the amount they're taking or stopping them, I don't know anything on the medical side of this, but is it then the hopes that they would stay with their dietitian's recommendations to continue those lifestyle changes? Is that the idea? Or is it still the combination medication, dietitian, lifelong friends?
Well, I think people should be lifelong friends with dietitians anyway.
Yes.
Whatever support they need, we're here to help them on their health journey. The decision on what path someone takes after they wean off the medication or if they decide to stay on it is really individual. It is going to be based on what's going on in their lifestyle, what's going on with their other health conditions if they have any, what's going on with weight. So they're going to hopefully be working very close with their healthcare practitioner, the primary care physician or the weight loss specialist, to determine what to do. And then the dietitian is always kind of in the background as a resource to help these people as needed.
And what are some behavior changes that you do encourage your patients to take while on the medications?
One thing we recommend is making sure you're getting enough protein. When people lose weight quickly, you tend to lose muscle mass. So what can happen is a person can technically end up having a higher percent body fat because they've lost the weight, but they've lost too much lean mass. So what you're doing is you're trying to preserve as much muscle mass as possible. So we prioritize protein. You also want to make sure that they're getting adequate fiber because with less intake, you can have changes in GI function, so such as constipation. So kind of making their meals colorful. and making the nutrition really count. So for example, if someone is eating fast food and they're just eating less, that's not the path that we want them to be on. We want to help them figure out how they can nourish themselves in a better way.
That's fantastic. So if I was to call your group or go on your website, I know you said there's a drop down box, but what could I expect? Walk me through if I was to call your office? Would I get a call back? Would I get a consultation? What does that initial maybe week or two look like?
Sure. So the initial contact can be made either through the website. You can book your own appointment. You can ask to be contacted, and then I will reach out to people, or you can call. So when a client calls, we set them up in the system, and then they receive forms to fill out, like at a doctor's office. You go into a portal, and one of the forms is a nutrition intake form. And basically that form goes through everything: their health history, medications, supplements. And one important question that we ask them is, what does success look like to you? Because we want to determine what do they want to get out of the visits with our group. So that's where it starts. In the initial consultation, we ask people if they've had labs recently. It's a good idea to do that, so you have a baseline. Then we go through their nutrition intake form, and we start setting up some initial goals. One of the questions is, do you have emotional eating? That is a super important area to work on if they have that. And it's something that would really get in the way if the goal is weight loss, is if they are not able to limit their emotional eating. It's a very personalized approach because these are all individuals. So what one person is doing is not what the other person is doing. What one person's strength might be another person's weakness. So we're really trying to meet people where they're at.
And I assume that if someone is reaching out to you, it's because they are already at that motivated stage to put the work in themselves. Do you ever have to really give them some extra encouragement to stay on track, or everyone is really ready to jump in?
That's a great question. So I think there is a good level of motivation if they are reaching out to us. As you work on some of these changes, initially, people are really fired up. As time goes on, it does become harder because we're working on changing habits. And that's where we tend to lend a bit more motivation. We're not looking for perfection. We're looking to get on a path, this healthy path. If you get off, we're trying to coach them, just recover as soon as possible. That's really the important thing. The important thing is not that you feel like you made a poor food choice and you ruined everything. It's, I am on this path, I got off a bit, but I am going to get back on. Because you can imagine the difference in the results. If someone is on their path, they veer off and they continue veering off, as opposed to recovering in a day or so.
Absolutely. So going back to some of these medications, Laura, what advice would you give to someone considering these for weight management?
Again, I think they may be working with their doctor and they have already decided that that's the path they're going on. If they are meeting with me initially, ideally, if you can change your habits and if weight loss is a goal, achieve an ideal weight and maintain it, then obviously the medications would not be needed in that situation. If I do see that someone may be a good candidate because they are doing the things that should promote weight loss, but it's not happening and maybe they have insulin resistance going on and haven't discussed it with their doctor, I may suggest that they go back and discuss this with their doctor to see if that would be a path for them.
Beautiful, beautiful. And where can our listeners go to learn more or, speak to you? You've given us your website. Do you have any social media presence or what can you share about that?
Sure. We're on Facebook, Walsh Nutrition Group, and also on Instagram. And you can always just contact us through the website or give me a call.
That's been really helpful. So Laura, when you're working with someone, do you see any common side effects with people on some of the GLP-1 medications?
Yes, it's not uncommon to have some side effects, and actually sometimes the side effects are so strong that people do not stay on them. They may have like nausea, vomiting, diarrhea, constipation, and bloating. So basically GI disturbances. The side effects tend to be worse when someone starts out on the medication for the first few weeks, and then the body does seem to adapt a little. When they start out at a lower dose, usually for about 4 weeks, and then they go up to a higher dose. It's really individual. I've had some clients that have experienced no side effects. I've had ones that have had minor and others that had to discontinue the use because it was just something they couldn't tolerate.
That's interesting. And have you heard of any serious or long-term risks people should be aware of?
Serious or long-term risks are relatively uncommon. People on GLP-1s will be working with a healthcare professional who will be looking at labs, assessing symptoms, talking to their clients just to see how they're doing on it. There are some rare side effects like pancreatitis, gallbladder issues, or even thyroid tumors. Another side effect that we talked about previously was when people lose weight rapidly, there may be muscle loss. We're also finding that there might be some bone loss as well. So those are some things to consider before going on a GLP-1 medication. Some research is showing that the GLP-1 medications are having promising side effects. For example, there's studies showing that they can actually slow the progression of chronic kidney disease. So I think as people are on these, we're going to learn more and more about any sort of side effects, but also some benefits that may not have been considered.
Wow, you mentioned lifestyle habits are very important. What would you suggest as far as some lifestyle changes that would benefit the weight loss?
Sure. So I think a person's success depends a lot on creating new routines. Those routines would involve changing their food intake, moving more, managing stress, and especially stress if that causes emotional eating. The medications make it easier to lose weight, but they really don't replace the need for healthy habits. So that's probably one of the biggest things that I can reinforce today is that you want to change your habits as you're on these medications. And that's really just to set yourself up for future success. You don't want to revert back to poor habits when you get off medications, if that is the path you take.
Have you had any personal, in your group, success stories?
Yes, we've had several people who have lost 15 to 20% of their body weight. They were having increased blood pressure, diabetes was becoming out of control, and it basically just flipped those disease states. So essentially, it's decreasing risk in these disease states that could actually shorten life. So I do think that it is life-changing.
Beautiful. And obviously they made those modifications in their lifestyle from your advice or your group's advice.
Yes. They absolutely changed their habits along with taking the medication. And I think that's why they were so successful.
This has been so educational, Laura. I know all of our listeners are going to just eat this information up, and we are so grateful to have you. If someone is interested in finding out more or meeting with a dietitian, what should they do or where should they go?
Our practice has 5 dietitians. We're all trained in weight loss and weight management, and we can certainly help people along on their health journey. If people are interested in making an appointment, they can go and book online at walshnutritiongroup.com. They can call at 630-308-8706. The other thing I want to mention, too, is we are in network with Blue Cross and United Healthcare. So visits do tend to be covered, which is a huge benefit.
Huge. That is huge. That is so great. And it sounds like from your earlier career, you had a good hand in that making that happen.
That is kind of funny. Yes, that was where I started, was trying to get dietitians reimbursed for their healthcare services. The focus back then was not on prevention, and luckily it is edging its way towards that.
That's so fantastic. Well, exactly. I remember even for fitness, people were thinking, why would I buy a fitness membership? Well, you're kind of putting that money towards your health instead of maybe a doctor bill. But yes, it's very important to take the best care of yourself. And it sounds like if anyone calls, if anyone goes to your website, they will be in the best hands possible. So thank you so much for all of this information.
Well, thank you. I love talking to you about this topic. It's always great catching up.
Yeah, it was amazing. Thank you so much.
Thank you.
Hi, everyone. Welcome back. Thanks so much for listening to that interview between Laura and myself. I am joined with Carrie, but I did want to just say it was so nice to hear a professional's point of view, because sometimes when we're on Instagram or Facebook, we see influencers or some businesses sharing some information. So it was nice to hear an actual professional talk about these medications and how a dietitian can support, and just that she cannot prescribe the medications, but she can definitely give a well supported role with that. So that was wonderful to hear her, and especially with the resume she has, it's clear that she knows what she's talking about and is a true professional. Carrie, what were your thoughts after listening to the interview?
Yeah, so just like you said, I have seen a lot of influencers discussing GLP-1, and that's true. You don't know what their background is, right? Like if there's somebody taking the medication, they can come from it from that perspective. But it was really nice to hear Laura speak from her background as a dietitian and how she works with physicians and with the patients to build a team around trying to make the best outcome possible and deciding, is this patient a good candidate for this particular medication, or would it'd be better for them to try without the medication? So I did appreciate that, because I have had questions as well about how the whole process works. I think it's very interesting that her group has grown so much. And she talks about how people who are diabetic, I think, originally started using GLP-1s, but now how some folks who maybe don't have diabetes might also have reasons to go on the GLP-1, and that if they decide with their physician that that's a good way to go, then Laura and her group would be a great support system for anybody who's venturing into that weight loss management medication. So I found it very interesting and helpful. I really appreciated that interview.
Wonderful, wonderful. Well, just alone how she has grown, like you said, her group and her practice from starting out with that food science background. And now she has this impressive group and is able to take on so many different clients because of the different specialties that she has hired through her new dietitians within her group. Very impressive resume and very impressive woman all over. Definitely check out the Walsh Nutrition Group on her website, and we will share all that information in the show notes.
Thank you so much for listening, and we'll see you next time.
See you next time.
Hi, everyone. I want to take a moment to give a heartfelt shout out to my amazing family, my wonderful husband, and our incredible kids. Your love and support mean the world to me, and I'm so grateful to have you by my side on this journey. Thank you for being my biggest cheerleaders and for inspiring me every day. I love you all. The topics discussed on Redesigning Health and Home are for entertainment purposes only. We are not physicians and we are not counselors. Please just enjoy this as it's intended to be. Thanks for listening to the Redesigning Health and Home podcast. If you've enjoyed this episode, we would love for you to like, share, and follow along so you can catch us on all future episodes. You can find me, Meg, at Fit, Fed, Feeling Good on Instagram, Facebook, and YouTube.
And you can find me, Carrie, on my website at homestylewithcarrie.com and on Instagram and Facebook at homestylewithcarrie. That's Kerri. And you can find both of us at Redesigning Health and Home on Instagram and Facebook. So join us next time for more inspiration on creating a home and a lifestyle that truly supports your best health.